All right, good morning, Matthew. Welcome to True Hope Cast. I appreciate you taking the time to talk to us today. How are you? What is going well?
Good, thanks. Thanks for having me on your show. What is going well? Uh, my health. I feel great these days. I've had a long bout of schizophrenia for pushing 3 decades, but I've recovered in the recent year or two or so, and it's wonderful. So that's what's going well.
Well, that's something certainly to celebrate. Congratulations for that, because that's something here at True Hope Canada. That's a condition that we work with quite frequently. So, and we know how serious it is and how significant it can be for some people, and not everybody has the success story that you clearly have.
Yeah, yeah, it's a tough slog for sure, but yeah. I've sort of got two audiences. For one group who've never gone through mental illness, I try to tell them, like, look, it's a lot worse than you think. But for the people who are going through it, they already know that, and I try to tell them it's easier than you think. It feels so tough, but you can get through it. You can just keep going. You've got so much more inside of you than you think to fight this stuff. So yeah.
Wonderful. Well, we'll probably come in and out of talking about that and mind aid as we learn a little bit more about what you do and what they do. And obviously, you have a connection with mental health, and I'm sure it's that there's a personal reason why you've gone into the line of work that you have. So why don't you just, for a little introduction, let us know kind of who you are and what it is that you do.
Sure. So my main thing is helping people with mental illness in developing countries. I've got a website, mindaid.ca, mindaid.ca, and I I at my worst in 1994 when my disease first hit me. A lady said that I looked like I was walking through a world of flying glass. I literally felt like I was living in a war zone here in a relatively sleepy part of Canada. And years went by. I recovered slowly, week by week, for many, many years. But it wasn't until 2016, 2017, and I saw my first bit of content online about mental health in developing countries. Through my whole recovery, my heart went out to people in war-torn countries, people in extreme poverty, who have the horrors of mental illness to go through as well. And when I saw this TED Talk around 2017 or so, by Vikram Patel, he talked about helping people with mental illness in developing countries, and it's relatively new. He made models of basic mental health care starting in the 90s, and there are groups using these models now with great success, and they've been helping thousands and thousands of people get back up on their feet, get back being productive, being able to feed their family again, and reclaiming their lives. And I'm trying to build their capacity. So I found 8 groups, nonprofits that you can donate to. I'm relatively new to this field. Plus, I've had to work on my own recovery in the last so many years as well. So I haven't been able to be as productive or go tackle bigger things like I really want to. I'm sort of taking it small, step by step. I got on one social media channel after another, just slowly adding them, watching my own recovery at the same time. But there's 8 groups you can. So I'm kind of keeping myself out of the financial loop of it. People can donate directly to me on my Patreon page to help me with my own finances. But as far as donating to help people with mental health in developing countries, I steer people towards their websites. Those 8 nonprofits I found, I steer people to their websites. You can donate directly to them and take me out of the equation. Down the road, if I have the strength, confidence, mental health to run my own nonprofit or social business, that is something I would definitely like to do at some point when I've got that capacity in my own health. In the meantime, if anybody wants to start a nonprofit or social business on their own and help these people, that would be amazing. If anyone wants to start a nonprofit or social business and have me as part of it, at least doing what I can do, be more of a spokesperson. I love getting up in front of the camera, stage and screen, talking about this stuff. So I'm willing to help out where I can. But yeah.
Very cool. Tell us about, like, what are we actually seeing, or what are you actually, I suppose you're not going to see anything unless you're looking for it, in regards to looking at these developing countries and how mental illness and tragedy and trauma is affecting them. But like, which countries are you looking at, and which countries are you working with, and what is it that you're actually seeing?
So I've never left North America. I'm 50 years old. I've never left. It was a struggle for me to go to Vancouver, Toronto earlier in my recovery, but I did it. I was able to do those things. To go to other countries, I still haven't gotten over that mental leap of could I do that, even like to Europe or something. There's a lot of so the groups that I steer people towards, those 8 nonprofits, you can see on their websites the countries they work in. A lot of them are in Africa, some Central America, Asia, primarily those. But one interesting note on that is uh, one of the groups, Basic Needs US, they're based in Massachusetts and they work in developing countries. They did a pilot project with this model of basic mental health care in a rural, poor rural indigenous place. I think it was New Mexico, and they also worked in poor urban environment. I think it was Detroit, and they got great results from that. So these can be not just, I mean, there's a man, Shekhar Saxena, in recent years. He's from Harvard, and he said at the UN that every country, when it comes to mental health care, is a developing country. Country, every single country has. I mean, yes, I'd rather be in Canada for mental health care rather than some countries in Africa, but still, our mental health care system in Canada is what he's saying is classified as a developing country's mental health care system. We need that much more work. So I don't have boots on the ground. I do know that the websites, those 8, they can tell you more about what's going on. I do have on the resources section on my website more groups other than those 8, but you can't donate or fundraise to them as far as I know. They're just more sort of awareness or advocacy work that they're doing in developing countries. And yeah.
Why do you think? I totally agree with the statement that all countries, even Western countries, are very underdeveloped when it comes to mental health care. Completely agree with that statement. Why do you think we're in that state?
It's so much fear around the brain. I mean, they said that decades ago, people were afraid to talk about cancer. If you had cancer, you just did not talk about it. Why? Why was cancer not talked about? The brain is a bit more easier to think about because it's a sort of this mysterious thing. Who knows what goes on in it? You can see as that hundreds of years ago as people being afraid to talk about or just not understanding. Was cancer something like that? Was it a mysterious thing that just sort of showed up in people's lives? Was that why they didn't want to talk about it? I don't know. I am glad though that a silver lining of the pandemic is people talking so much more about mental health. So one thing I'm excited about is that, so I mean, I made my website mindaid.ca in 2018 before the pandemic. We'd been talking about mental health a lot more in the last 10, 12 years already. And the pandemic sort of blew it wide open. And so I'm really excited that maybe now is a time that mental health in developing countries could get more of a push because it is vastly under-resourced. Some countries have only 1 psychiatrist per million people. There are over 270 million people in developing countries with no mental health care. That's like almost the entire US, mentally ill and poor and all the other problems. And I'm hoping that, I mean, I think, but I'm 50. I remember in the 70s and 80s as kids, we would take little UNICEF donation boxes around with us on Halloween trick or treating. So donating to developing countries is not a new concept to us. We've been buying goats, we've been drilling wells, we've been building schools for decades in other countries, developing countries. And mental health, why is that not being, if you go to UNICEF or World Vision, there are catalogs online of gifts you can buy. There's all sorts of things you can do to help somebody there, but mental health really isn't on the list. And I did find an article recently online of why they're not doing that, and they laid out some reasons, but I'm hoping that can change. It needs to change. Strong Minds, one of the 8 nonprofits I steer people towards, strongminds.org, they help women with depression in Africa. They don't use medications. They use group-based talk therapy. They get women in groups of 8 or 10. They meet for so many months, once a week or so, and they get really good results getting rid of depression in them. Strong Minds wants to scale their operation drastically. They're trying to work with the larger organizations like Oxfam and whatnot, saying, look, can you use our simple model and try to scale it out to more people because it works? These models of basic mental health care, and there are different variations of them, they're low cost, they're proven effective, and they're scalable. The World Health Organization is trying to figure out the best way to roll them out to the masses. In the meantime, these 8 groups that I found, they are doing the work and rolling it out, and I just want to build their capacity so much more. So,
Yeah, I think the last question I just asked you is such a huge one, right? It's like, why are we so underdeveloped in most countries when it comes to mental health care? I think your connection with cancer is very interesting because it just makes me think the fact that we don't do very well with things that we can't see and things that we can't touch, hear, smell. So, with our very limited senses, when it comes to somebody who does have cancer or somebody who does have mental health problems, it's not so easy to connect with that thing because we can't visually see it. But then we have something like the pandemic over the last couple of years where the fear and the fear and the scarcity around those events, and it's obviously been in the media and it's on social media. It's literally just absolutely everywhere, so it's kind of palpable. You can see and feel the fear in communities and around the world. So it is, in a sense, it's become a little bit more, rather than that just like mysterious mental health thing that we can't see, we're starting to feel it with our senses, like energetically. That's what I kind of feel. I feel like, if you go into a particular room with a really strong energetic vibe, you can feel that. It changes your energy within you. And I think that the last couple of years, 2.5 years of what's happened has given a little bit more of we can connect to what people are going through and what we're also going through ourselves with our senses. And I think that gives it a little bit more of a reality, and it gives people out the ability to step back and say, okay, this is actually like real. This is, I'm not the only person going through it. And I think when people understand that, they then going out and speaking and being with other individuals and talking about it, being a little bit more open and vulnerable to the idea of talking about their mental health, where, and it's okay not to be okay all of the time. I certainly see some positives that have come out of COVID, where people are open to talking about these things a bit more.
Yeah, it's there's a group in New Zealand, Voices of Hope, and they said that they're a mental health group, and they said that yes, COVID brought a lot of mental health whiteout, and we're talking about a lot more. There are still some mental illnesses that aren't talked about as much. Schizophrenia, which is what I've got, is one of them. There are some others too that still aren't getting enough attention or talked about as openly. It was, yeah.
Yeah, it's, as you say, like I think that also within the highest medical community possible, the brain is still massively misunderstood and not understood. Like, we might know 1% of it, but I don't think we know about as much about how the brain works as we'd like to think. So I think a lot of what people go through with depression and anxiety and PTSD, OCD, schizophrenia, bipolar, all these types of things, we know some stuff about them with our experience and clinical data and clinical studies and looking at these things, but there's still the understanding of the brain and how it works, because it's so obviously unbelievably complex in regards to its capabilities and its connectivity, and how we're also wildly different in regards to how our brains fire and wire through decades of learning different things in different environments. It's quite unbelievable and beautiful and unique in that aspect. But yeah, it's tricky to be able to say, okay, this one thing is going to cure and heal all of the depression. We've actually kind of tried that with medications and it's not really worked. So it's a very complex and fascinating issue. And I wonder how you're talking about these organizations, and they're all charitable nonprofit organizations, and do other countries, in regards to mental illness like support each other. I take the example of like Ukraine at the moment in the last 6 months, how many countries, the US, Canada, the UK, have sent loads of money over there. That's that's great to be able to do that, but it's like how do other countries support these underdeveloped or developing countries with something like mental illness? Do we is it about giving them money? Is it about giving them resources? Is it about giving them, it's difficult. Like what do you believe in your experience of working with these organizations, working with these countries, working with mental health? What is it that we can do to support these countries and these individuals who, don't live in, Western nations?
Yeah. Just to be clear, some of the stuff I don't know. I'm not in a ton of conversations with people who are more. One good group for that is United for Global Mental Health. There's the term global mental health, which means mental health in every country, developed and developing. United for Global Mental Health, they seem to be doing a lot more of the more upper level things with people who have a lot more power than me. I've got a website and I'm on social media. As far as I know, I'm the only website I've got the only website of its kind in the world. If you want to go looking for all the groups working on mental health in developing countries, they're scattered across the web. I've got them as many as I can find all on one site, and I keep finding them slowly as the years go on. I keep finding more. I am, though, not in sort of conversations with more of the upper level people doing more of the work on the ground, doing work in with governments, talking to other governments. And I'd like to get involved more in more of that as the years go on. Right now, I sort of feel like I'm still getting my feet wet, learning who the players are, and trying to talk with them and whatnot. So, but yeah, I wish I could answer that question better.
Okay, yeah, no problem. No, it's a big question, and even if you were to kind of root through all of those websites that you mentioned, I think it'd be quite tricky to find an answer to that. I think that it's with so many things like this in regards to collective support, especially for like a nation or a community, it comes down to a lot of people like in the public donating money and resources and time towards these things. In many instances, the government doesn't step in to do this, but I don't think they even know how to do it, to be honest. So it's great that we've got people like you and these organizations coming together to really kind of take charge in you seeing a problem, actually doing something about it, rather than expecting it to be done for us by the powers that be. I think that's a very unrealistic expectation, but it's awesome that you guys are out there doing it. So MindAid, your website, got these, what type of resources available on there in regards to how people can get kind of involved right away?
So I've got a Facebook group there, the MindAid Facebook group, and people are welcome to join that and meet other people who are interested in helping brainstorm ways to fundraise, spread awareness of mental health in developing countries. There's about 70, 80 people in there so far. There's not a ton of discussion yet going on regularly. I'm posting in there. I'm hoping that'll change as time goes on. That's one thing people can do if people want to meet others. You're free to join that. I've got some merchandise, some sweatshirts, t-shirts people can buy. Donations go to one of the groups, Strong Minds. I list the 8 groups there. People can donate to them directly on their websites. They can fundraise for them. Strong Minds, again, has their own personal, you can make your own personal fundraiser right on the Strong Minds website platform, their software. I've started one. To be honest, I took a big leap this year, and I said I'm trying to raise $1.8 million US to help 10,000 women with depression through Strong Minds by the end of this year, December 31st, 2022. And I may fall flat on my face with that. I may be able to make some headway in that. Someone said, Matthew, if you got 2 sports teams, I'm in Canada. I'm thinking the Toronto Maple Leafs, the Montreal Canadiens hockey teams, they've had a long rivalry for decades. If I got their online fan groups to sort of duke it out between each other, saying who could raise the most money for this cause, that might be a way to do that. And I'm still working on it. I haven't approached the two groups of the online fan groups. They've got about 30,000 or more in each group. They've got a number of groups for each team. And that's an idea I have. Someone mentioned that to me. I thought that's a good idea. So I may be running with that here soon, approaching them saying, what do you think of this? Would this work? But people are welcome to donate, start their own fundraisers on their own or underneath my own Mind Aid fundraiser for Strong Minds. The link is on my website, Join 2022 Challenge. It's the Mind Aid 2022 Challenge. I will say Find Mind, they are relatively new. They're one of the 8 groups, and they've been around for a few years now. I want to get them more traction, more visibility, and get them more up on their feet. Get them more up on their feet. The actor Forrest Whitaker, most recently in Star Wars, his foundation is working with Find Mind, which is huge. That's a lot of celebrity shout out material there.
Yeah.
And so Find Mind, they work in northern Uganda, and they've been helping people get mental health care. Pavel Repo, he's the founder. He's in Colorado, and he's Another fundraiser I want to mention too, if people want to donate, there's a new group I found. They're the 8th one. I added them to the list just recently. They are doing things a bit differently. They use trauma recovery yoga. It's a type of yoga to help people recover from trauma. They're working in Iraq with the genocide that happened there. Refugees. It's really helping people there. They also want to move into Ukraine. They've got a fundraiser there for $8,000, and they want to move into Ukraine and help people there with trauma recovery yoga next year. So if people want to donate to that, that's on my website under the 8 nonprofits.
That's awesome. You mentioned a TED Talk beforehand. I can't remember the individual that you mentioned, but if you can mention that again. But you talking about models for basic mental health care. For the people who have not seen that video, can you run us through a little bit about that and explain that? Because I think that's very, very interesting in regards to, how do we start developing all nations in regards to their ability to support people within their country within mental health care. And if we can, we need structures, we need like fundamentals, we need like an idea that's going to, evolve and chop and change depending on the nation. So what are these basic models?
So Vikram Patel, the TED Talk, it's on my website, mindaid.ca. If you Google Vikram Patel mental health, it'll show up as a TED Talk. He said in the 90s, well, he was a psychiatrist, and he noticed that for decades they'd had manuals for where there's no doctor, what happens if you get a broken leg or get pneumonia or get any kind of physical health injury or disease. How do you treat that? Where there's no doctor around, no hospital for hundreds and hundreds of miles. How do you treat that? They've had those documents for decades. He thought in the 90s, why don't we do the same thing for mental health? So he did. They've got a document and different variations of it. The WHO, the World Health Organization, they've got a document. If you look up WHO MHGAP, MHGAP, Mental Health Gap Action Program, on their website, they have you can find documents for these models. It's like a 100-page document. It'll walk you through a lot with pictures and images so that you don't have to. It's not for a specific language. You read through this and find out how to treat somebody who's presented in front of you in a developing country where there's no hospital for hundreds of miles. How do you assess someone for what they've got, and how do you treat it? And that's a good example of what they can do. They've worked this out. They're low cost. They're proven effective. These models have gone through studies, and they're scalable. And so one of the things they do is they go into a community and they handpick certain people who may have some basic leadership skills, some basic health skills, anything to those degrees, and they teach them how to deliver this basic mental health care, these models. And that's it's called task sharing or task shifting. They take someone who's doing like maybe some maternal health care, delivering babies in the community, or they've got some leadership skills, and they teach them these other skills. They shift the tasks to basic mental health care.
Yeah, that's really cool. I mean, that's wonderful that there are organizations out there and individuals out there who are, taking the reins and creating this very, very smart system. I think the fact that you're looking for certain individuals who can support and inspire within groups and communities rather than kind of strangers coming in or people coming in from other countries, like actually using individuals in the community who understand the environment, understand the community. That's really, really smart. I really think that's a really wonderful, inspiring way to do that, kind of like from within that group rather than like external people coming in. You'd have to build that trust, that rapport. But yeah, that's a really wonderful way of doing it. When you were talking about individuals in like war-stricken countries and natural disasters, it was making me think of some of the amazing research we have for our flagship product here at True Hope Canada, which is Empower Plus. And we've used micronutrients. Well, not us especially. In New Zealand, we've had lots of researchers have used our product within individual groups that have suffered earthquakes, and how they've recovered very, very differently and quicker in regards to the stress of that type of environment with the use of micronutrient supplementation with that recovery. I think that's just a very interesting contrast in regards to how can we start supporting people in different ways who might be a group depressed, a group anxious, or like a group that is like collectively stressed because of this event that's happened within that country or that city or whatever it might be. I think getting kind of unique with the approach and how you might support those individuals it's very important to be able to do that, whether that's like therapy or using therapeutics or using something like supplementation. You're talking about this yoga as well. All these are incredible ways to give people different options. Not everyone might not want to do yoga. Not everyone might not want to take a supplement, but some people might want to sit and talk through what they're going through. So having different options that are accessible is unbelievably powerful. And if you don't mind talking about it, schizophrenia is also one of the conditions that our product has been researched for. What's your journey been like with schizophrenia? You say you've recovered. I think that's amazing. Like, can you tell us about like from diagnosis to recovery?
Yeah, so I was my youth was pretty average. I grew up in a small town in Eastern Canada and went off to university. But throughout university, I sort of felt one symptom coming on about once a year. But these were mild. This was late 80s to early 90s, and I didn't know anything about mental illness. I'd been taught mental health in gym class in the 80s and health class about, if you do too much exercise as a way to escape things, that's not good. So I had a little bit of an idea of psychology, but we weren't taught about depression or anxiety or bipolar or schizophrenia. I'd seen in movies, someone had a split personality and they were called schizophrenic, which isn't correct. People with schizophrenia, there is such a thing as split or multiple personality. And from my limited knowledge, as far as I know, that's caused by extreme abuse. Schizophrenia is not split or multiple personality. But I muddled through university. I bicycled across Canada when I was 20. I was on the university rowing team. I did a triathlon. I was taking engineering. I was getting mostly A's in engineering. I was doing well. I was living on my own, but I could feel these symptoms that once a year creep up on me. But I could still do all this stuff. They weren't limiting me that much. But when the disease hit, it hit hard. I went in a matter of weeks to just flat on my back, curled up in a ball, shaking, not knowing whether I was going to live or die from one moment to the next. It was terrifying. I describe my story to people. They say, Matthew, what you're describing to me is terror. I'm like, yeah, it's scary. But I wish I'd known in those years, the early, especially the first year or so, was that the pain can lessen. The pain can lessen, and that will allow you to keep fighting for longer. It's hard when you're in that pain to think of anything other than that pain, that pain can go down in time. The unknown is so hard to deal with. I mean, I was diagnosed with schizophrenia at 22. They say, here, try a drug. If it works, stay on it. And good luck, get some counseling, and next.
Okay.
It's they don't say you fall into this class or grade or type of schizophrenia, which means you will get better in X number of months or years. They say, we don't know what's going to happen to you. Unknown. We don't know. We don't know if you will ever get better. We don't know anything. But I want to tell people that it's possible. Navy SEALs are taught in their training. Look up Mark Devine. He's the author. He's an author. He teaches people how to think like a Navy SEAL in his books. He says Navy SEALs are taught in their training you're capable of 20 times more than you think you are. 20 times. They take them to the brink of physical and mental exhaustion. They're sleep deprived. They're lying there saying, I can't move another muscle. They say, oh, you think you're done? No. You've got not just twice, 20 times more than you think you do. And they teach them to get up and keep going, keep going, keep going. That's the way. I'm no Navy SEAL, but that's what I felt like I had to do for years, was just keep going, keep going. So I got on the medication. It worked glacially slowly, but I noticed an improvement in my health every single week for years, from 94 till about 2012, once a week. From 2012 onward, I noticed an improvement sometimes once a day, sometimes twice a day. And February 11th of 2021, during the pandemic, my symptoms just stopped. And since then, the last year and a half or so, I've been in this sort of state of just shock. Sort of like, wow, did I just go through that? Did I just go through that? For those who can't see me, I'm doing air quotes here. Did I just go through that? Just over 27 years? It literally felt like I was blindsided, pummeled, hit from behind for 27 years. And then I just had the last year and a half this time to think. I've had full, complete thoughts instead of thoughts that go round and round in circles and don't get anywhere. I get to think, I get to reflect, I get to just exist in my body and not feel pain. What a treat that is. I'm still on my medication. I'm not going off it anytime soon. You'll have a hard time getting me off it, but I know medication is, a controversial topic for some people, and I don't want to get into that. I've, yeah, it's, yeah, yeah.
Well, congratulations, Matthew. It's I mean, mental health is just such a wild ride anyway, and everybody goes through their own individual version of it. And yeah, when you're talking about the pain there and the unknown and the isolation, and it's a very dark, deep, very dark time for a lot of people, and it can certainly seem like that's your reality, and that's the only reality that will ever exist. So coming out of that, congratulations. Yeah, it's a really amazing thing. And medication for so many people is incredibly necessary. Like, I feel everything has got its place. I think, I've spoken to so many people in my personal and professional life that have used medication very successfully. People have come off it, and yeah, it's everything certainly has its place, and whatever an individual needs to kind of get them out of that cyclical place of just that pain or just that terror or just that isolation, to give them the ability to do the other things that we know are super beneficial for your mental health, then sometimes these things are incredibly necessary. I was going to ask you, so apart from the medication that you take now, are there any other things within your routine that that you kind of like need to do to stay symptom free?
Well, throughout my life, I've always sort of lived a relatively healthy lifestyle anyway. I mean, I'm no Olympic athlete by any means, but I mean, I never was much of a partier or stayed up late. I've always tried to eat fairly healthy. I'm not perfect, but I will say, can I talk about supplements for a sec? Or is
Oh,
that
please.
okay?
Absolutely.
So there's a book, Memory Rescue, by Dr. Daniel Amen. He's a leading brain scientist in the States, and he's got a ton of books out, and he's got a Brain Warriors music program on CD or Amazon. I think you can get it on Apple too, maybe. It's uses brain waves to help recalibrate your just overall brain health. like
Wow.
alpha, theta, delta waves. And he recommends in his book Memory Rescue, well, he said some of the healthiest brain scans he's seen, he scanned thousands of people's brains, some of the healthiest he's seen, and I believe he's speaking about just general overall brain health, are people who've taken ginkgo biloba through their life. So that's one thing I've added maybe a year or two ago. I started taking that. So, but yeah. Can I just say something for a sec about schizophrenia? Because I know a lot of people are mystified by it. They don't really know much.
Absolutely, Matthew, please.
Okay. So so hallucinations in any of the five senses, audio, visual, touch, taste, smell, people can have hallucinations with schizophrenia. I never did. I'm in the 25% of people with schizophrenia who don't hallucinate. But I had other common symptoms like disorganized thinking. There's other things too, but a lot of schizophrenia, I had depression and anxiety. A lot of it wasn't sort of that different from other kinds of like depression or anxiety. It was, for me, it wasn't as different as people sort of can't understand it. People can kind of understand depression or anxiety because they've had a little bit of depression or a little bit of anxiety, just a normal, healthy emotions for anybody. But I just want to mention that. The other thing is that a lot of us, people with schizophrenia, are no more prone to violence than the rest of the general population. If one definition of violence says 2% of the general population is violent, the same for schizophrenia. 2% of people with schizophrenia are violent. We're more likely to be victims of violence because we're sick, we're vulnerable, we don't fight back. That's another thing that I wish more people would know. I was never violent. I've never wanted to hit anybody in my entire life, whether I was sick or healthy. I never wanted to take a swing at anybody. And just because someone may be talking to themselves on the side of the street with schizophrenia doesn't mean they're necessarily going to be violent. I just want to help dispel the myth that people with schizophrenia are violent. It's tough. It's tough to go through life thinking, what are people thinking of me? Do they think I'm a serial killer or something standing right beside them? I really did not have to go through that.
Yeah.
To help
Yeah.
people with schizophrenia.
No,
On my
sorry.
website.
Yeah, sorry, carry on. I was just going to mention that I really appreciate you sharing that
Okay.
perspective because people don't usually rationally break down things they don't understand, especially something like schizophrenia, which is, it probably doesn't get the best press in movies and theater and within media. It's probably not depicted as as it really is. So yeah, I think a lot of people have a lot of misunderstandings about those things. So I really appreciate you sharing that with me. So yeah, sorry to cut you off there. Carry on.
Oh, no worries. Thanks. Yeah, like I said earlier, with the Voices of Hope saying that some mental illnesses need to be talked about more. Schizophrenia, I do feel more comfortable talking about mental health in public. Like if I'm on the sidewalk or in a coffee shop and there are strangers around me who I have no idea who they are, I can talk about mental health and depression and not worry about that. Schizophrenia, I'm like, don't know who's around, don't know what they're thinking. But I mean, it's literally ridiculous. I mean, yes, when you go out in public, you don't know what's going to happen. An asteroid could hit you. There's always a fear of something. Something could happen to you for simply being alive. But it's basically like saying, well, if you're left-handed, don't tell anybody. Don't let anybody know you're left-handed. Use your right hand for everything. And,
Right.
in the old days, that's actually kind of what they did with, my dad, he's left-handed. He was taught to write with his right hand in school when he was a kid. But it's like people who are left-handed are no more prone to violence than the rest of the general population. The same as schizophrenia. It's the same. And it's ridiculous. It's like, if you're left-handed, could you imagine just whispering that you're left-handed in public, like so no one could hear you? That's what I've been doing for years with schizophrenia in public. Just whisper the word schizophrenia. Don't say it out loud. And I know I was never through the Holocaust in the World War I and II, never went through that, but I have some sort of analogies, the best I can come up with of, it felt like, it's just one more thing to add to my plate with all the
Sure.
confusion and mental health I had to go through. I had to think, don't let anybody know you're a quote unquote, this, they may think you're a serial killer or something. I hated that. Just one more thing I had to go through. But I want to say what I was going through before was on my website, mindaid.ca, there's a free tips button there. And I've got a list there of my top books and everything I recommend, resources for just general mental health. But I've also got on that same list a list of some schizophrenia resources. Lauren Kennedy, she's got a YouTube channel. She's in Alberta called Living Well with Schizophrenia. I really enjoy her YouTube videos. She really informs people what it's like, and great resources. Cecilia McGough, McGough. She's got a TED Talk called I Am Not a Monster, Schizophrenia. She's got a nonprofit, Students with Psychosis. She's in New York City. She has student advocates with schizophrenia and psychosis all over the world. They're doing great work for younger people with the disease and psychosis. The other thing is that there's a new therapy for people who do have hallucinations. It's called avatar therapy. The link's on my free tips button there too. And avatar therapy, there's a place in Montreal, Canada, you can go to get this. It gets rid of your hallucinations in a matter of weeks.
Wow.
It works for some people, it works partially for some people, and it doesn't work for some people. But I talked to someone a month or two ago. I mentioned this to him. He said, thanks so much for telling me this, because I stood up to my hallucinations one day. I said I was tired of them running me, and I stood up to them. It was intense. His mom said I heard him in the next room and sort of worried about him. But once I found out what he was doing, I was okay with it. And he said I stood up to them, and it diminished his hallucinations to a certain degree. That's what avatar therapy does. You get to talk back to this avatar on a computer screen that represents your hallucinations. There's a therapist in another room. You can't see him or her, talking to you through this avatar, and you get to stand up to your hallucinations, saying, it's a very, I don't know how it works, but they say it works in a matter of weeks instead of going through years or a lifetime of hallucinations, which I think is incredible.
That's remarkable. Yeah, I'm just on the website now looking at it, and it looks like it's a 3D virtual reality technology based therapy where, as you say, you have like the VR mask on, you probably got some headsets on as well, and you're tuned in, and you can visually see this object, this individual, this avatar. Looks very, very interesting. I will make sure that that's linked in because it looks very fascinating.
Thanks. Yeah. Someone I know with schizoaffective disorder, which is a combination of schizophrenia and bipolar, he's just on a tangent here. Not all hallucinations are horrible. Some are actually quite beautiful and enjoyable. But for the most part, from my understanding, hallucinations are tormenting. Someone screaming at you all day long for years, insulting you, degrading you. You never get away from it. Brushing your teeth, it's always there. They say it's tormenting. To have that gone in a matter of weeks, oh my gosh.
Remarkable. I'd love to hear. I'd love to hear somebody talk us through that type of recovery using an incredible technology like that.
Yeah, there's one more link there I want to mention. Anosognosia. It's a symptom disorder, whatever you want to call it, where you don't believe you're sick. It was discovered by a doctor whose patient decades ago didn't realize his left arm was paralyzed. He just did not believe it, even though it was. So with anosognosia, they say, look up Dr. Javier with an X, it's like Xavier. He says Dr. Javier Amador, Amador. That link is on my free tips button too. And he works with people who don't believe they're sick. A certain percentage of people with schizophrenia, bipolar, other mental illnesses don't believe they're sick when they do need treatment. And his method helps them get treatment. Dr. Javier, his brother, had schizophrenia and didn't believe he was sick. The method that he uses, and it sounds too good to be true, but he's helped many people with it. He says you get to talk to so often when someone doesn't want to take treatment and their family says, yes, you do need treatment, it causes rifts, it causes conflicts. Sometimes the police are involved trying to get them into a hospital, and it just pushes the person farther away. He says, you stop doing that, you start talking to your family member through a non-confrontational kind of conversation technique, and that he teaches on his website. And you rebuild your relationship with your family member. His brother, he did this with his brother. He rebuilt his relationship with his brother. His brother started taking treatment and kept taking treatment. Why? This is the part that sounds too good to be true. But he says his brother took it not because he didn't think he was sick. He still thought he was sick. But he took the medication, got treatment for his family.
Wow, that's
He
great.
loved his family. They built up the relationship with him. I'm doing it for you guys. And I'm not an expert. I may be getting something in that wrong. I haven't gone through all Dr. Yavier's videos on his website, but I'm just like, that could be huge for so many people trying to get someone to get treatment.
Wonderful. That's very, very cool. Now I will make sure that all of those links, I think you'll have that tips page. I've just gone through that myself. It looks very, very cool, very in depth. And yeah, all those links are certainly worthwhile checking out. Not necessarily if you have schizophrenia, but family members, and just I think general knowledge is just important to learn about these things, to have a little bit more empathy and understanding about what the reality is, rather than what we've depicted through whatever means that may be. And I just wanted to mention, as you talked about ginkgo biloba in these brain studies from sorry, who was the individual?
Dr. Daniel Amen,
Daniel Amen, that's right. Yeah, Danny Amen, that's right. Yeah. So yeah, one of the 36 ingredients in Empower Plus, our flagship product here at True Hope, is ginkgo biloba, and I believe it's put in there for that particular reason, because of the wild amount of research that is available now, that this is an incredible supportive brain phytochemical. So yeah, I just wanted to mention that. That's just really cool that you mentioned that as well. That's really cool. So mindaid.ca, is there anywhere else that people can connect with you? That's the kind of the best way to do that?
So the contact section of mindaid.ca, there's my email there, info@mindaid.ca. People can reach out to me on social media. I'm on YouTube, TikTok, Instagram, Twitter, LinkedIn, Facebook. Yeah,
you're everywhere, man. That's great. Yeah. Well, Matthew, thank you so much for joining me today. I really appreciate your time, and I think that I'm going to personally be diving into some of your resources, because it's great when somebody with the experience and the passion behind something like schizophrenia, but also supporting mental health around the world, and especially developing countries. I think that's really, really admirable and wonderful, and I love to be able to get all that information in one place. That's really awesome. So, but thank you so much for your time today.
Well, you're welcome. Thanks so much for having me. Really appreciate it.
Awesome. Wonderful. Well, for any information, I'll put all the links in the show notes so you guys can get access to that. Don't forget to subscribe if you haven't yet. But this is True Hope Canada, the official podcast of True Hope. I will see you next week. Thanks, guys.